On this Monday, all new at 6, Georgia is going through a COVID surge, mirroring what we are seeing in other parts of the United States.
Yeah, doctors say it is nowhere near as intense as this past winter's Omicron spike or the Delta wave from last summer. Joe Ripley spoke with the experts to learn why the numbers the state is reporting don't tell the whole story of this surge.
Doug Robinson says he's only had one worker out with COVID in the last few weeks.
We don't take it for granted either, because it has, business has been holding up for us.
But a recent surge in COVID cases has left his bookshop in Decatur in suspense.
Now I know at least a dozen, if not 15 different people who have contracted it in the last 2 weeks, I would say.
We are no longer staying at home, wearing masks consistently. Many of us have kind of started living our lives again, and part of that is getting infections.
Infectious disease doctor Jesse Kalk with Piedmont Atlanta Hospital says cases in Georgia have been on the rise since late April. State health officials tracked 3,000 new cases a day in its most recent count. But Kalk says that number leaves out many positive at-home test results, or people who might be infected but did not test at all.
For us to have a good number of those at-home tests be reported, there needs to be some kind of easy infrastructure to access.
Kalk says that kind of reporting system would have to come at a state or national level.
During all of this entire COVID thing, we feel like we've been kind of a survivor.
Doug Robinson says during the current COVID surge, he might consider cutting back hours, but he doesn't intend to close the book on business anytime soon.
It would take a lot for us to just say, oops, we need to close temporarily. So I don't think we're going to get there.